Welcome to the EKG Guy. If this is your first time, I'm glad you're joining us. And if you're looking at this for the first time, well, you are joining our echo course, okay? And this specifically is our point of care echo course. We'll briefly touch on a number of topics, get you familiar with it. We'll have a separate in-detail course coming out soon, so look out for that with a book to accompany that and all the lectures. Now, if you're new to the EKG Guy, we're so glad to have you here. My name is Anthony Kashu. I'm a physician resident at Mayo Clinic and trying to deliver you some of the concepts that I struggled with in a more digestible format. Okay, so here we're going to look at point of care echo. Obviously, we have over 400 or over 500 lectures on EKG, so you can look at that. But let's get looking at point of care echo now. So what I want to look at here is what is it? So what is point of care echo? Well, this is a focus, goal-directed, qualitative transthoracic echocardiogram that would perform by us, the clinician or the medical professional at the bedside. Okay, so if you're on morning rounds, if a patient's coming in, being admitted, this is something you could do at bedside, and it gives you a lot of things. And we'll look at the advantages as well as the limitations of this and what it does not replace. And firstly, I'll tell you what it does not replace. It does not replace your clinical exam, and it does not replace a comprehensive echo, okay, because that provides quantitative analysis, which we'll see this does not. So here we have the point of care echo. This is a quick, non-invasive bedside assessment. So this is an advantage of it. It's efficient, you can do it very quickly, and it's cost effective, okay? Now they're making handheld devices that you can carry around and just do this as the patient presents. They're lightweight, they're pocket sized, they're portable, and you can get a quick assessment of what's going on in the patient that's presenting. This is an adjunct to the clinical exam. Again, it does not replace the clinical exam. It provides immediate answers and early diagnosis in emergent situations. So a lot of emergency medicine physicians are very equipped, and even the residents are learning how to use this because this can provide a lot of information early on in the acute setting. This allows for serial exams, okay? So say someone's admitted with a pericardial effusion, you could follow them daily to see if there's improvement if you're skilled with how to equip and use this. Then patients with heart failure as well. Now, what we can use this because it's so efficient and cost effective, a lot of underserved or remote areas that are not equipped with more high-tech innovations or things that we have, machines, can use this, okay? Now, what are the limitations of this? And there are some, and we don't want to understate them. As echo, with all forms of echo, this is operator dependent. It requires specific training. You want to become efficient with it. You want to know how to locate the accurate windows and move the transducer around. Okay, and this is the transducer here. Now, what it also has is that it has lower limitation or lower resolutions. It's limited ultrasound frequencies, lower the resolution, as well as the image optimization. Okay, so not as good as the machines that we have, but again, this is a quick, someone's coming in acutely and you want to evaluate them. The screen size tends to be small because it's, again, pocket size. We tend to carry it around. Here you can see what seems to be an iPad that you can carry. It's limited to 2D, so 2 dimensions. Some have color Doppler, but most do not have any spectral Doppler. Okay, and if you're not familiar with that, we'll go through those things as we move on. And in our course, we'll go into detail on the different forms of Doppler and how they're used. Now, another thing is that if you have incidental or unclear findings, then you have to confirm them with the conventional echocardiogram, okay, whether it's transthoracic, and maybe you even go up to transesophageal in certain settings. Now, it does not provide any hemodynamic measurements, and it's limited in the assessment of the valve. So here you can see the mitral valve that's highlighted there. Okay, this is the right ventricle, interventricular septum, and left ventricle. We won't get into all the details here. Now, another thing is not reimbursed, but obviously this is if the patient's care is going to be impacted and it's going to provide a benefit, we do it. Okay, we want to make sure we provide the best care to our patients, and so reimbursement tends to not be an issue. But for hospitals, this is something that certainly they have to consider. Okay, so again, this is point of care echo. Hopefully this is making sense so far. Again, this is just meant to be an overview and intro to what we'll see. So let's just review before we end here. So again, point of care echo is a transthoracic echocardiogram that we perform at the bedside. This is focused, goal-directive, and it's qualitative data we're getting, not the quantitative. Advantages, obviously, it's quick, it's efficient, it's cost-effective, lightweight, we can carry it around. It's an adjunct to the clinical exam. It does not replace the clinical exam or the comprehensive echo, okay, because that's the one that provides the quantitative analysis. Again, this provides immediate answers, serial exams where we can follow the improvement of the patient over time, whether they're hospitalized or not. And again, this can be helpful in remote or underserved areas. Now, some limitations we mentioned, operator dependent, but you'll see this is in all forms of echo because you really need the skill to perform this accurately and need the practice, okay? Now, it's lower resolution, has limited ultrasound frequencies, and the image optimization, what you can do with it is also limited. There's a small screen size usually, okay? It's limited to 2D. Some have the color, but often don't have spectral Doppler. Incidental unclear findings, we still need to do the conventional echo. Again, no hemodynamic measurements and limited valve assessment, and obviously not reimbursed because we tend to do this for serial or more acute setting. So this is the point of care echocardiogram, okay, a bedside assessment that we can do that provides qualitative analysis of the cardiac structure and maybe something and even give us or clue us into a diagnosis as the patient presents. Well, that's the end of this lecture. I hope you learned something. Now, just to keep you in mind of our course material that we have available, so again, if you go to our website, www.ekg.md, okay, so this is our website, and what you'll notice is that if you go to the EKG course here, okay, you'll find stuff that's separate. So notice that we have a number of topics, practice material, lectures, a way for you to contribute, and this is the course here over here. So you'll notice we have over 300 videos or so, and that's more on YouTube. There's another 100, more than 100, about 200 videos that are available with the course. So those are separate videos, and this course is really designed to take you from a beginner to advanced interpreter. Okay, so completely separate from what you're getting online for free. Okay, these are course material that comes with it. So notice that you have a book. Okay, and then you also have the pocket guide available, so you can choose which format. They are the same thing, both these book and the pocket guide, different formats. I really like this small one because you can keep it in your white coat if you're in the clinic or in your pocket, and it's really available on the go. Now, with the book, you also get videos. So notice these are the videos, okay? And these are a video for every single page in that book. So it's over 30 hours of video. Now there's a number of practice material that I continue to upload there. Okay, we'll have practice questions coming soon. So all of that's available. Again, this is separate from all the free material that you get already. Okay, so this is more high yield stuff. This is what we used to teach our technicians here and our students here at Mayo Clinic. And it's used now among many institutions. So check that out. Now, what it also includes are calipers. So yes, you get calipers with this course. Okay. I don't know anyone else that offers that, but you do get calipers. I think they're very helpful, and they can, if you know how to use them correctly, can help to identify different arrhythmias that are going on. Okay. And then you also get our pocket Ekg Reference. Okay, this was something we've put together as we were developing course for the fellows, and this is really nice. It has every code, as you saw earlier, laid out there. Very small pocket guide available. I had help with my colleague, Dr. Peter Noseworthy, who's the head of the EKG lab here at Mayo Clinic, in editing it. So this is something that we use, and we found very helpful. So go to the EKG course. You'll see examples of lectures, okay, why we developed this, okay. A lot of it came about from myself struggling with learning EKGs, having a father that was an interventional cardiologist and, still struggling. So my struggle is a struggle that I don't want you to have in learning them, okay. You can read all those introductory books, but honestly, they are not enough. okay, and you find yourself using other resources, which is part of the learning process, I wanted to expedite that process for you and make it less inefficient in pretty much what I struggled with going and learning through EKG. So again, from beginner to advanced level with this course, you get the book, the calipers, the coding reference, video access, okay? And now we're offering 25% off. 25% off. Put that code in on checkout, and you'll have yourself 25% off that will even, it's pretty much covers the cost of what we use to print the material. So we don't really make much off it. It's more to help our learners grow and really be able to contribute to patient care. That's why we do this, and we love doing it. So thank you so much for your support. If you have any questions, just leave them below, and we're happy to answer them. All right, have a great day.